So, we will have some demo here. Demo edita session, we'll go for the theory. Means almost in the demonstration, I'll be talking about theory only. Okay. And in between, I'll be showing you some inspiring videos. Okay, അത് എന്തിനാണെന്നറിയാം, നിങ്ങൾ ഉറങ്ങാണ്ടിരിക്കാനോ. എവിടെ പോയി? എല്ലാവരും തിരിച്ചെത്തിയില്ലേ? He ran away from here. He was sitting here. He ran away to the back bench. Okay, so I request, please fill up the gaps, okay? Because demonstration, these people are standing in the center, you won't be able to see. Front row, please fill up the gaps. The car ku vendi irikkiya. Why don't you people come over here? Boys verillakka pinnil poi irikkiya. വരുന്നുണ്ട്. Sit here. Come. നല്ല ചെയറും കൂടിയാ, സോഫ്റ്റ് ആയിട്ട്. ആ പ്ലാസ്റ്റിക്കിനകത്ത് ഇരിക്കുന്നതിനേക്കാളും നല്ല ചെയറാ. Seat is here, that side also. അവിടെ ബോയ്സ് അവിടെ അല്ല, ബോയ്സ് ഇവിടെ. ഐ വാണ്ട് യുവർ ഹെൽപ്പ്. ഇടയ്ക്കിടയ്ക്ക് വല്ല ടേബിളൊക്കെ പൊക്കണം എന്നുണ്ടെങ്കിലേ, മണിച്ചിത്ര താഴേനെ പോലെ ശോഭനേനെ പോലെ എനിക്ക് പൊക്കാൻ പറ്റില്ല. അടുത്തുള്ളവരൊക്കെ അവിടെ പോയി. കം ടു ദ ഫ്രണ്ട്. നീ ഗേൾസിനെ ഞാൻ വിളിക്കേണ്ടി വരും. മുമ്പിൽ ചെന്നിരിക്കേ. മുമ്പിലിരുന്നാലും പിന്നിലിരുന്നാലും ഉറങ്ങുന്നവർക്ക് ഉറങ്ങാം. നോ പ്രോബ്ലം ഫ്രം മൈ സൈഡ്. ബട്ട് ഡോണ്ട് സ്നോ. കൂർക്കം വലിക്കരുത് കേട്ടാ. ഓക്കെ, സോ I'll just show you one inspiring video first, and then we will go for the demo. Okay. Kutika. സൗണ്ട് വരുന്നില്ല. അവിടെ ചോദിച്ചു നോക്ക്, എന്താ സൗണ്ട് വരാത്ത? നോ ഫുള്ളാണ്. अच्छा, VLC സ്റ്റാർട്ട് ചെയ്യും. മേ ബി ക്ലോസ് ദിസ്. അല്ല മോനെ, ക്ലോസ് ചെയ്യണമായിരുന്നു. ഇത് ക്ലോസ് ചെയ്തിട്ട് VLC ഓപ്പൺ ചെയ്യും. ഓപ്പൺ വിത്ത് VLC. മേ ബി ചിലപ്പം അതിന് സൗണ്ട് വരുമായിരിക്കും. ഈ സൗണ്ട് കൂടി കൂട്ടിയേക്ക്. സൗണ്ട് ഇല്ലെങ്കിൽ അതല്ല, നിങ്ങൾ നോക്ക്. കണ്ടോ, somewhere it is loose. അവൻ വിളിക്കുന്നുണ്ട്. സോ അത് വരുന്നതിന് മുമ്പ് കേട്ടോ, അത് സ്റ്റോപ്പ് ചെയ്ത് കുട്ടി. സ്റ്റോപ്പ് ചെയ്ത് ക്ലോസ് ചെയ്തിട്ട് യു ക്യാൻ സ്റ്റാർട്ട് ഓഫ്. യു വിൽ ബി സീയിങ് ദാറ്റ്. ഓക്കെ, ക്ലോസ് ദിസ് വൺ. കാണുന്നുണ്ടല്ലോ. അതെൻ്റെ തന്നെ സൗണ്ട് വന്നോ? വൺസ് ഇറ്റ് കംസ് യു ജസ്റ്റ് ടെൽ മീ. ഓക്കെ, സോ വിൽ ഹാവ് എ ഡെമോ ഓൺ ലിംഫെഡിമ and one on colostomy care ആയിരിക്കും. Okay, how many of you have seen a lymphedema patient that is post mastectomy? They will develop lymphedema. Anyone in your relative അല്ലെങ്കിൽ ആരെങ്കിലും ഫാമിലി, ഐ മീൻ നെയ്ബേഴ്സ് ആയിട്ടില്ല? കൊളസ്റ്റോമി എത്ര പേര് കണ്ടിട്ടുണ്ട്? How many of you have seen any colostomy patients? You have seen. You have seen. This side also. Oh, many of your people have seen colostomy also. Okay. So when we talk about palliative care, lymphedema, colostomy care, and malignant wound care is a specialized care. Okay. So most of the time the nurses who undergo training in this only will be taking care of such patients. Okay, because it's a specialized thing. We need to know a lot about things. Why I am going to talk to you about this was, if you have the awareness of lymphedema, colostomy, you can send a patient to a palliative care where they can improve their quality of life. That is one thing. They can lead a very normal life. That is the second thing. Okay. As a sound illingly, you won't have that feelings. വരുന്നുണ്ടോ? So do one thing for time being, ഇതെടുത്ത് മാറ്റിയേക്ക്. അവരപ്പോൾ അതിനകത്ത് നോക്കൂല. Okay. We'll do one thing. We'll start off by the time the IT people come. Okay. So we get a lot of patients after mastectomy, post-mastectomy, maybe from about within 6 to months, years together, they'll come with a lymphedema. Lymphedema is nothing. What happens is, after once we undergo a surgery, mastectomy, all the lymph nodes, they must have excised. Means excision is being done. It blocks and the lymph starts getting into the interstitial space. So they will have a edema. Okay. So such patients, they will find it very difficult for their daily functions. Usually after the surgery, they are taught how to take care of it. In the sense, they are taught some exercise, some massage, and the patient is asked to carry it on so that they won't develop edema. But what happens is, come here, fast. But what happens is, after some time, some years, patients do start coming. Okay. Some patients who regularly do the exercise, that regime, okay, they may come after 10 years, 11, 12, 25. I have seen some patients who had come after 24 years of surgery because they were doing their normal functional things. Okay. But patients are the who go back home after this one. Family will tell, just now operation ippana kazhinjathu, onnum cheyyanda, rest edukku, rest forms rust. And they will come with a big edema. I will show you tomorrow that one. Okay. So today, let us see what we do usually for this patient. So first and foremost thing is, we have to confirm that the patient is having an edema, because edema cause can be anything. So we need to confirm it is actually a lymphedema. Okay. But if the patient is having some comorbidities like diabetic, hypertension, otherwise a stroke patient can also come. If they are having something, we have to be very careful before starting a lymphedema. Even cellulitis. Patients with lymphedema, they will have cellulitis and they will come and tell us it is lymphedema. So we need to know what are the signs and symptoms of cellulitis. Understand? So once it is clear, there is no complication, no DVT, no pulmonary edema, no cardiac failure, patient is only just having lymphedema, we can go for a lymphedema care. Okay. Now the second thing is, most of our patients, okay, when they come to us, they come with a bystander. Someone will be there to help them. So what we thought was, previously it was like the therapist means maybe a physiotherapist, occupational therapist, as well as a trained nurse. They used to give the lymphedema care for the patients. And the patient has to come to the hospital. So പലപ്പോഴും എന്താ സംഭവിക്കുക, ഒരാഴ്ചയൊക്കെ വരും, അത് കഴിഞ്ഞാൽ ഡ്രോപ്പ് ഔട്ട്, because they cannot reach out. Now you think you have a lymphedema clinic ഇവിടെ ഉണ്ടെന്ന് വിചാരിച്ചോ, somewhere patient is coming from Trivandrum, എന്നും വരുമോ patient ഇവിടെ? It's difficult. ഒന്നും വേണ്ട, somewhere in the ഇവിടുത്തെ ഏതെങ്കിലും ഒരു കുറച്ച് ദൂരത്തുള്ള ഒരു വില്ലേജ് നമുക്ക് പറയാം. Daily coming is really a problem. Okay, so just we shifted to that. What we thought, something we have to teach them, teach the family member so that the family member can take care of the patient at home. And the local palliative care can make a follow-up. Okay, so that is called a very simple thing I am going to teach you. So I will be teaching you how to do a lymphedema bandage, what about the exercise and massage. So I told you, why I am giving this awareness to you is, tomorrow if you see someone, you can send that patient, whether it is a colostomy, tracheostomy, or even a lymphedema, you can send that patient to the nearby palliative care. Okay, so that they can get full support from that palliative care. Good? നിങ്ങളുടെ ലാപ്ടോപ്പിൽ വരുന്നില്ല? ഇത് ക്ലോസ് ചെയ്തിട്ട് എല്ലാത്തിനും മ്യൂസിക് വേണം. That is why I thought I will show them. Okay, yeah. അപ്പുറത്ത് വിട്ടിട്ട് reels ചെയ്യണം. Just watch this. Okay, starting good though. Okay, I love this video very much because it is people are living in a place, it's a land of opportunities. All 5 fingers are not the same, right? When you all put your ideas, that is why what is we have seen in the project work, what you have done on the downstairs and here. It was very beautiful. Okay, hats off to you people. Okay, and so this is something like that. Wherever you are, put your work, put your ideas. People will be there who resist and persist. They do it. Okay, but if they see that your work is good, tomorrow if they see that you are doing some very good communication, they will start working with you because they know that you are doing the best. Okay, Leah and Alka, come here. Okay. So for a lymphedema care, we need some cotton rolls, some gumji rolls, and some crepe bandages. Okay, crepe bandage is 6 centimeter, 8 centimeter, and 10 centimeter. Most of the time we take 2 pieces of 8 centimeter also will be okay. And of course we will have micropore, scissors, and tape measuring tape. And of course one pen also we need it. Okay, so suppose the patient has come to you. Give your hand to this one. Patient has come with lymphedema. First, what we need to see is about their skin. But most of the time, the patients with the lymphedema, their skin, if they are not going into any treatment, they neglect it, the skin will be very hard. Okay, it will be just like an orange peel. Orange into the orange it will be very hard. Okay. Second thing, if you ask the patient, they won't be able to do any function. They say it's heavy on it, I can't do anything. In that cases, we can give. And again, the shape of the edema. Most of the time, the shape will be distorted shape will be there. We can give it. But suppose the patient is saying, I'm having pain. We cannot start off with the care. We have to reduce the pain. In fact, the patient should be clear that the patient is not having pain. Then we can put the bandages. Okay. So a lot of criteria is there when we start off. Okay. So let us see if this patient has come, the patient is having edema, and we confirm that it's a simple lymphedema for the patient. Patient doesn't have any comorbidities, everything is fine. We can go ahead. Okay. So first and foremost is skin care. So skin care means daily bath the patient has to take. Wipe it. Wipe means it is pat and dry. Pat and dry. Because we have to prevent the skin. Apply some moisturizing cream. Even simple coconut oil also is good. We can just apply it on top. Okay. And then we can start off with the bandages. Patient should not wear any jewelries. No, watch also. They all have to avoid on that side. Soon after mastectomy, this has to be taught to the patient. No IV cannulation, no injection, this all. Even BP cuff, we have to avoid. Okay. So now we have confirmed everything. This patient's very good. Patient is not having any nails, clean. We have to tell the patient if they are having nails to cut the nails, not to put mehendi and nail polish and all. Because we need to see the nail buds also. Okay. Inside. ഈ സൈഡിലുള്ളവർക്ക് കാണാൻ പറ്റുന്നില്ലെങ്കിൽ യു ക്യാൻ കം ദിസ് സൈഡ് ഓൾസോ. ഓക്കെ, അല്ലെങ്കിൽ എഴുന്നേറ്റ് കുറച്ച് ഇങ്ങോട്ടേക്ക് വന്നോളൂ. സോ ഫസ്റ്റ് വി ആർ ഗോയിങ് ടു ടേക്ക് ദ മെഷർമെൻറ്റ്. കൈ പിടിക്കണം കേട്ടോ. So when we take the measurement, what we do is, it is first 2 centimeter from the wrist joint, centimeter from the wrist joint, first one. Okay, from the wrist. Okay, then it comes 4. So right from here till here it should be 4 centimeters next. So we will be marking like 4 4. So usually the patients has to be remove their upper garment. Okay, should be exposed up to here. After that we have to take the circumference. Okay, so when we take the circumference also, from the marking, at the point of marking we have to take, either it should be above the marking, otherwise it should be below the marking. Okay, not that one I have taken below the marking, the second one I am taking above the marking. No. Okay, so here I am taking below the marking. That is 15. Okay, so we have a chart for it. Okay, right and left hand, and we will mark it on that. So each point we have to, now this is the 16. Now next point, that was 15. This is 15 and a half, 17, 19, 21. It goes like this. Is it clear? So we have to take both the hands, affected and unaffected hand we need to take. Why? To compare it. Okay, then what we do is, next we are applying the cotton. Go. Okay, so when we apply the cotton roll, usually what we apply for the this one, orthopedic patients cast we apply, that cotton roll we have to apply so that it's soft also and it keeps rolling also. Okay. She is so thin that I have to do 1 or 2 times. No applying of pressure or something, just keep on rolling it. Actually, we have to put a micropore over here. I'm not going to put, okay? Because when I remove, everything will go. Okay, so when we are applying this also, see that the patient is having a support, because otherwise they will start having shoulder joint pain. Okay, on top of that, we will apply the gumchi pad. This is gumchi pad, ellarku ariyilla. രണ്ട് ഗോസിൻ്റെ ഇടയ്ക്ക് നമ്മൾ കോട്ടൺ വെക്കുന്നത്, we use it for the dressing. That same thing, we have made it a roll. Okay. So here we need a one more piece because it has to go till the shoulder. Okay, anyhow, it will be till shoulder. Next we go for a finger bandage. See, this is a 6 centimeter bandage. I have folded it because we don't get finger bandage. Okay. So now we have to apply a little pressure. But we have to leave the bud, nail bud, so that we can see if there is some a sinuses or something. If it is too tight, we can see the sinuses. The patients who are having edema, this bandage won't slip off. It will stay back nicely. Okay now. So you need to keep asking the patient whether they are feeling it tight. And വെള്ളമുടി മാത്രം കാണുന്നുണ്ടല്ലേ. If it is tight, then just keep on looking at their nails also. There should not be any cyanosis. And don't think it is so easy to apply also. It's very difficult to apply for a patient. We will also get exhausted. Because the family who is staying with the patient also, they cannot hold the patient's hand for a long time like this. So in between we have to relax, then apply it. So can you see here? 1, 2, 3. Okay. At the back, this only 2 will be here. Now we are going to apply the 8 centimeter bandage. So in patients, usually what we do is, if the patient's edema is too large, okay, we avoid putting gauze band or roll over here. We will start only from here. That also we can do. But anything, don't apply the crepe bandage directly on the patient's hand, because it will give a print on the patient's skin. Okay, that we don't want. So always from when we do take it from the distal to the proximal, here it will be tight. As it goes up, it becomes loose. Why? Because the lymph has to flow from the distal to proximal. That's the next one. And you can also sit holding your hand. So this is how it will be once you apply the bandage. Okay. So with the bandage, we will teach the patient about the massage and exercise. So first is the skincare. What we call it is as four cornerstone management. First is the skincare. Second is the compression bandage for when we said tell about compression, multi-layer bandaging is for the distorted shape. If there is a shape, good shape, no other problems, the patient can go for stockings. Okay. And the next third one is massage, and the fourth is the exercise. Okay. Okay. Now here, first we have to teach the patient is how to take a breath. Means 10 abdominal and the chest breath we will. So we tell 10 deep breath they have to take. So what how we teach the patient is we ask them to keep both the hands if possible. Otherwise one hand at least on the abdomen. Skip one hand. If the patient is able to fold, the patient can keep this hand also like this. Okay. See, she finds it difficult without an edema also. You can think about the patients. Okay. So they can just keep. And now you all keep your books, sit straight, upright. Come on. Relax. Both your hands should be on your lap. Just relax. When I tell you take deep breath, take a deep breath, hold it. I will count 1, 2, 3, 4, 5. Then I will ask you to relax. So through the mouth you have to relax. Okay? Take a deep breath through the nose and leave it through the mouth. Okay? So take a deep breath. Hold it. 1, 2, 3, 4, 5. Why we are taking breath? What happens when we take a deep breath? What happens to this chest? It expands. So what happens when our chest expands? All the vessels are open, flow will increase. So this the patient has to do 10 times. Okay. Next we will start with the massage. You have to hold this for me. So when we are doing a massage, okay, always stand in front of the patient. Okay, now it should be a bare hand, no gloves, no cream, nothing has to be applied. Okay, so usually what we do is, see, we have a lot of lymph nodes, superficial lymph nodes, because deep lymph nodes we don't know where it is, right? Superficial lymph nodes here in the neck, our clavicle, underarms, chest, then of course on abdomen, then it goes scanty. Okay, but for the upper lymphedema, we usually clear off these places only. Okay, so what we are doing is trying to clear whatever it is, so that whatever is the load is there, that also will be clear. So first we have to clear the load, then so that from the other side, affected side, now automatically the lymph will start flowing. Okay, so what we do is with the 3 fingers, okay, just we are moving the skin, not on both the sides. It should go just like this. So if I do for her, okay, 1, 2, 3. This should be 10 times. Okay? Now the second. Once I did. This is the second. 1, 2, 10 times. Okay, if you ask for me means you see 1, 2, 3 because my neck length is larger than her. Okay, so 10 times I did 10 times. Just next comes is our clavicle. Okay, so when it comes to the clavicle, hers is a closed one. Okay, clavicle means see our collarbone. So you all know our collarbone where it ends to the shoulder joint. You see, this is the place. You all can see this is the place where it ends. So we have to start doing from there, both the sides of the neck, both the clavicle we have to do. So with 2 fingers we will be doing, just with 2 fingers. So what we do is, some patients, family, they say they cannot do with the left hand. So what we tell them, first you do the one side and then you with the other side you can do it. So what we do is, just support your hand on the patient's chest. If you don't support, what happens? Suppose I don't support, I'll be doing like this. See, it will pain the patient. But suppose if I support it, it won't pain the patient. So what I do is, with 2 fingers, you see here, this is the starting. 1, 2, 3, see, 10 times. Just a half moon. It's not a full circle, it's just a half. See, 1, 2, 3, it's also 10 times. Okay, this is the second point, 10 times. Third point, 10 times. Fourth point, 10 times. Okay, so if I do for a patient, I can do with my both the fingers. It is from outside, we have to go inside. So we will complete till this notch. Okay, then next is the underarm. On the unaffected side. Why? Affected side, nothing, no lymph nodes are. Okay, so it is under the unaffected side, we have to do it. Okay, so when we do it also, suppose if I am doing for her, my hand should be under this one. You just see, if I keep it like this, okay, and it's just squeezing. See, 1, 2, 3, 4, just squeezing, because we are doing it only for the superficial nodes, lymph nodes. Okay, so again this for the 10 times. Okay, so that is finished. Next we will come to the chest. Now when we start with the chest, it is just below the clavicle till the nipple line. Starting from the unaffected side, the direction also towards the unaffected side, and slowly moving towards the affected side. Okay, I'll come that side once. So I'm going to start from the unaffected side, just below the clavicle. So I can do with my both the hands also, otherwise I can do with my single hand with the 3 fingers or the 4 fingers. Okay, so what I do is, you see, I'll start just below. 1, 2, 3, 10 times, 10 times, 10 times, 10. 10 times, 10 times, 10 times. The direction should not be towards the unaffected side. Why? All the load will come this side again. Okay, so we need to remember the load should be clear towards the unaffected side. Okay, so first point I did, this is the second point. 10 times, 10 times, 10, 10, 10. Then comes the nipple line. 10, 10, 10, 10. Clear? Okay, then we will go for the exercise. Okay, now you can turn this side. Leah. Come here. Alka, just hold her hand at the 90 degree. Okay. Now the very important thing is, whenever you are doing, this patient needs a support. Okay, so usually we ask the patient to sit near the dining table or a table so that the patient will have a good support. And we have to keep a pillow under the arm, but the palm should be free. Keep it here. Yeah. The palm should be free. Okay, and it should be in the 90 degree. Okay, so you all can do, the first exercise is stretching the fingers. Stretch the fingers. Keep it on 90 degree, come on. Stretch the fingers. Paining. Now, when we say stretch the fingers, you should have a pain when you stretch. The muscle should strengthen. Sadhana patient nodu nammal chodigum. Relax. Patient nodu chodigum. Stretch the fingers or mendakudra ingane vekku angatike. Appo nammal chodigum. Ullile ingane peshigal ingane ida tight avana pole appo avaru parilla. Appo you do it like this. You see, you will have that strengthening of the muscles. Why? Our vessels are with the muscles, right? So it starts pumping, muscle tone pumping. It helps the lymph to flow. Okay, the lymphatic system no padikkan pattilla. Buddhimutta. Okay, so otherwise I need to ask you people. Okay, so again we will start doing each exercise. Okay, first exercise, stretch the fingers. Now count 1, 2, 3, 4, 5. Relax. Again 1, 2, 3, 4, 5. Relax. She's doing a very good thing. See, from backside she's keeping her hand on the front shoulder. Okay. Now the second exercise is, make a tight fist. Come on, make a fist. This is the fist. This is not a fist. This is the fist. Make a tight fist. Make a tight fist. Okay. Now, when you ask a patient, it will be difficult for a patient to make a fist also. So usually the bystander will help the patient to do it. Whoever is doing, we'll ask the patient. We'll do it like this. Then we can count 1, 2, 3, 4, 5. Relax. Again. 1, 2, 3, 4, 5. Relax. You know, each exercise has to be done for 20 times. Okay. Now the third exercise. Okay. Bend your wrist towards the floor. 1, 2, 3, 4, 5. Relax. Again. 1, 2, 3, 4, 5. Relax. Okay. Next. Bend your wrist towards the ceiling. 1, 2, 3, 4, 5. Relax. Again. 1, 2, 3, 4, 5. Relax. Okay. Now next. Rotation towards inside. Rotate at the wrist joint inside. Okay. Now I'll tell you something. If you find it difficult to rotate, some people are dancing. Put your hands like this. You can also keep, yeah. Okay? Now you try to rotate. It is better. When you hold it and do it, it will do it properly. Okay? So, one side. Now outside. Next exercise. It should go outside. And now the last exercise. Keep your hands straight. Flexion at the elbow. Flexion at the elbow, I said. Don't turn. Okay, keep your hands straight. Make a tight fist. Flexion at the elbow. Turn. What happened here? The bicep muscles get tightened. So how many exercises we did? We did 7 exercises. First, 1, 2, 3, 4, 5, 6, 7. These are the 7 exercises what we teach our patients. Okay? And after that, you can ask the patient again to take 10 deep breath exercise. This the patient has to do at least twice in a day. Okay, what happens is after the never the patient will never come back to you. Usually what we tell the patient is, see, stroke, massage 10 times each stroke, exercise 20 times, breathing exercise 10 times. It's very difficult. So what we tell the patient is, how much you can do it. And I assure you, within 1 week the patient will come and tell you, my hand is now soft, weight has reduced. Even what this one, a bandage we apply, no? They will say extra is there. Because once the edema reduces, it becomes extra. So they have to cut it. Regular, the patients who follow the regime, okay, within 1 month, if it is a very bad distorted shape, it will come to almost the other side, normal side. Normal side, how it is, almost to that normalization it will come. But the patient has to continue doing it with the stockings. Thank you. Give them a clap. Come on. Let it be here only. Okay. Now, the stockings is given for the patients who is having a good shape. Edema is there, but the shape is there. Okay. But this one, multi-layer bandaging, they can apply it for 24 hours. If they apply it today, next morning they can remove, have a bath, give a skincare, reapply it. But stockings, at the bedtime, they have to remove it because it will start slipping off. Okay, so only at the bedtime they have to remove. Daytime they can apply these things, they can do their work also. I have taken, even this one, interviewed patients, I have taken the videos of the patients who says that this is one of the best things that they are doing. Because what happens is, edema reduces, they can work properly, I mean, they are active, function very normally. Only the problem comes when the patients start developing any comorbidities which compromises our heart and lungs. Then it becomes a little problem because we cannot load the heart, right? You all know it is. Overloading is not good. So in that cases, we need to tell the patients, simple exercise, we ask the patient, no bandaging, nothing. Okay. Now some other things are, whenever the patient is sitting anywhere, not to put the hands down. Always it should be on the, try to be on the shoulder level, not to bend like this. Because what happens? The collection will be over here. Not to wear tight clothings. Especially sari blouse and all, you know, they will wear very tight. So what happens? It will be tight over here, here also. So what happens? The collection will be more on that side. Tomorrow I will show you some photos, okay, some pics. Okay. So that they know. When they are lying down, not to. So usually when it is winter season, we all sleep like this, right? So they are not supposed to sleep by folding hands or on their hand. It should be always kept on a pillow on the side, rested on the pillow. And this we make a follow-up. So somewhere about 3 to 6 months when the patient comes back to the main center, then we will take the, again the measurement. Okay. And almost it has reduced nicely, then we will ask the patient to go for the stockings. Clear? Okay. Have a look at this video. വീണ്ടും സൗണ്ട് അത് ഓപ്പൺ അവിടെ ക്ലോസ് ചെയ്തിട്ടില്ല കേട്ടോ. സ്റ്റിൽ വന്നു. അതുകൊണ്ടാണ് നല്ല ബുദ്ധിമുട്ട്. കുറച്ച് വീഡിയോസ് ഉള്ളതാണ്. ക്ലോസ് ചെയ്തോക്ക്. ക്ലോസ് ഇറ്റ് ഫുള്ളി. PPT ക്ലോസ് ചെയ്തു. ക്ലോസ് ചെയ്തോ. വീണ്ടും സൗണ്ട് വരുന്നില്ല. അതന്നെ. And you do one thing. Just read that one. Okay, it got a really nice background music, but I want you to read that one. I hope you people are reading. So that penguin also and this one also, if you see, we all are not perfect. We all have some crack, not this crack, huh? Okay, something. Okay. The only thing is, whoever is working with you or with whom you are working, you have to accept it. Okay, that's what we will tell. You develop yourself also, try to develop others also. Okay, and that is what it showed also. Because that crackpot was feeling that I am not doing anything good because half of the water goes away. But what did that woman find? That is the side where the flowers were put. So there were flowers on that side because she knew the crack of that person, that flaw of that person. Okay. So you've been friends, you are working together, you will come to know how the next person is, other person, maybe you're a junior or a senior, whoever it is. Okay. So you can change them a lot in your life. You can help them out. Okay. And even though they are not perfect, at times what happens, with your help, they will become more perfect also. But they should never feel like that I am not good for nothing. എല്ലാവർക്കും 100% മാർക്ക് കിട്ടാൻ ബുദ്ധിമുട്ടല്ലേ? ആണോ? It's difficult. Okay. But the person who is getting 100 and a person who is getting 50, maybe that person will be having a better attitude than a person who is getting 100. So that's the difference in each person. So that we need to take it into our life also. That's what I told you. Attitude is a very big thing. You know, when we do everything, this one I will show you is about the attitude. Let them make something, I will see. Attitude. What needs, that mathematics they have to do it, and it's very perfect. Actually, they show these videos to the engineering college students. Okay. So we will have that also. ശരിയായോ? നാളെയെങ്കിലും ശരിയാക്കണം. Because നാളെ communication ഉണ്ട്. So I will have some videos, picture and videos. So I need it. Okay, now we will have colostomy. So colostomy, that is stoma done for a patient who has undergone a descending colon or a sigmoid colon colostomy. Okay, maybe now. But we have disposable bags also. You see, this all are disposable bags, plain bags, disposable bag. This is a disposable bag. One piece disposable bag cost about 300, 400 rupees. 252, you can say 300 for, according to the quality. Okay. 2-piece bags are there. Now, this is a 2-piece bag. See, this is a 2-piece bag because it has a plate, okay, base plate and a bag. This goes from 400 to 700, 800, again, according to the quality. Okay. So, a patient who has undergone a descending colon or a sigmoid colon colostomy, patient can jolly well go for a irrigation. Now you may ask me, all the patients, do they go for irrigation? No. I have met 3-4 patients who are not doing irrigation also. One patient is a മലയാളത്തിൽ പറഞ്ഞ എന്താ കൊർത്തികൾ പോലത്തെ അങ്ങനെ ഓരോ സ്ഥലത്ത് ഇങ്ങനെ പോയിക്കൊണ്ടിരിക്കുകയല്ല, അങ്ങനെ ഓരോന്ന് ഇതൊക്കെ ഉണ്ടാക്കുക അവർ. ദാറ്റ് പേഷ്യൻ്റ് വാസ് വെയറിങ് ദിസ് വൺ, ചിരട്ടല്ലേ, കോക്കനട്ട് ഷെല്ല്, ആ ഹോളുള്ളത് എന്താ പറയുക, കണ്ണോ എന്തോ അല്ലേ, അതായിരുന്നു പേഷ്യൻറ്റിൻ്റെ കൊളസ്റ്റോമി ബാഗ്. He has made 2 holes on the side and he was wearing that. Inside he has kept some cloth. So whenever it gets wet, he will throw it off. Okay. And skin was so beautiful. No erosion, nothing. Okay. So I thought, why should I talk to that patient? Second patient, as I tell you, I will show you this one, who was wearing a aluminum, this one, bowl. Aluminum bowl the patient was wearing, that I will show you. Okay. Another 2-3 patients, one patient was a male patient, he says, soon after the surgery, he had this one habit of smoking. So what he does was, soon after, when he told, before the surgery also, I smoke, I go to the toilet and I smoke. That's how he is having a bowel movement. So after the surgery also, he did the same thing. He's having a bowel movement. So doctor said, you should not smoke. So he came and asked me. I said, you smoke. Because his bowel is moving, na? So why should we stop it? And it's not going to make any difference. That was the ultimate this one for him. Other two were ladies, youngster. What they say was, soon after surgery, every day they used to go and they made it a mind that it will come out, it will come out. So slowly they made it a habit and they are having a normal bowel movement. I had met 3 patients. One was a patient already married with a baby, with a child. So after this colostomy, he thought that now for me, nothing is there in my life. Okay. Finally landed in our palliative care where we taught him this colostomy irrigation. And when he had come back after doing this, after so many years, he said, the benefit of doing my colostomy irrigation is now I have one more son. That's what he said. Recently, one of my friend who is little bit not here in another place, she called me and she told one of her patient, she's a colostomy patient, she was pregnant also. Completed her pregnancy, she had given birth to a baby. So colostomy is not an actual problem. The thing is, we don't know how to take care of the colostomy. Okay. Rest two are, one is a businessman, another patient is a KSRTC bus driver. Okay. He actually went to commit suicide only. He said he cannot leave. Because he has every now and you know what happens colostomy, every now and the motion will be emptying in the bag. But finally when he came to know about this procedure, still he said bus driver. He's doing it very well, but he's doing it for a school bus only. Okay, so we will see how it is being done. Okay. You can stand up. Can you remove this? So, usually a patient who is having colostomy, so it will be on the left side. Okay, because descending colon and sigmoid colon is on the left side. You all know it very well. Okay, so the patient comes, maybe the patient will be wearing a reusable, otherwise a disposable, whatever it is. Now, suppose the patient gets up daily by 5 o'clock or 6 o'clock, daily routine. Okay, patient can just go to the washroom. So, 2 things they can do it. Either a washroom where no one else should use, it should be particularly only for him, for her. Otherwise, they can do it in one corner of the some room or even in the bathroom. Okay, but not to use the this one western commode. They can use a bucket. Okay, so think this patient got up early morning. So this is called a long sleeves. As you all can see, there is just like an enema can. This one. Sorry, there is a hole here. It's a hole here. I have put a rubber band. Okay, so now the patient will be having a stoma bag over here. Okay. Now the patient got up in the morning, the patient removed this bag. Now the patient will see, this has to go to the stoma. Okay. Think this is the stoma. Okay. So there should not be any nails. Patient should always wash the hands. We teach them the way. Okay. So patient can just put little oil for lubrication. No need of silicone jelly on down. And they can just put the finger inside the stoma. Okay. Just to see whether it is patent. Okay. Now, the second thing is, as I told you, this is just like an enema can. You see, there is an opening. 0.500, 1.5 liters of water we can take. Just plain water is okay. Towards the northern side and all, we say if it is winter season, they can take a little bit of lukewarm water. Otherwise, plain water. And this should be hung just before the shoulder. Just before, above the shoulder level. Okay. It has a regulator and it has a funnel. So just open it to expel the air. What we do for the IV fluids, just like that. Open, we have expelled the air. We have taken about 1.5 ml of water in that, plain water. Now lubricate the funnel. Okay. This the patient, once you teach them, they will do it. Okay. And we have to insert this about 1 to 1.5 inches. We have inserted it. Now ask the patient to cover this with this. See, it is kept covered. Why, when we open the first time, suddenly the water comes, it will splash on their face. So better to cover it and keep. Open the regulator. So the water started flowing. The first initial stage, sometimes the patient, once 500 or 700 ml of water goes inside, they will feel that bloating. Okay, some discomfort. So you have to tell the patient, if you feel something like that, close it. But gradually, day by day, they will be able to accommodate at least from 1000 to 1.5 ml of water. Okay, and before the air entry, before finishing it, you have to close the regulator. Okay, now it takes about 10 to 15 minutes maximum for the water to go. Okay, and then we can remove it. Now, this is kept for washing. Okay, all colostomies, these bags are just washed with hand only. Okay, no washing it on the stone. അത് മനസ്സിലായോ സ്റ്റോൺ എന്ന് പറഞ്ഞപ്പം ഞാൻ നോർത്തിൽ പോയപ്പോൾ ഐ വാസ് ഇൻ നോർത്ത് ഇന്ത്യ അവരെന്നോടൊരു ക്വസ്റ്റ്യൻ ചോദിച്ചു, നിങ്ങൾ എവിടെ നിന്നാണ് വരുന്നത്? ഞാൻ പറഞ്ഞു കേരളത്തിൽ നിന്നാണ്. ചോദിച്ചു കേരളത്തിലെ ആൾക്കാരെന്തിനാ തുണി എടുത്തിട്ട് കല്ല് ഇടിക്കുന്നതെന്ന്. അവർക്കൊരു തുണി കല്ലയിൽ ഇടിച്ചിട്ടില്ലെങ്കിൽ ഉറക്കം വരില്ല അത്ര. ടപ്പേ ടപ്പേ ടപ്പേന്ന് കേട്ടിട്ടില്ല. നല്ല ഉറക്കമായിരിക്കുമ്പോൾ കടാ ടേന്ന് അടിക്കുന്നത്, നമ്മളെ ഉറക്കം പോവും അല്ലേ? ദാറ്റ് ഈസ് എ യൂഷ്വൽ. അത് നടക്കാറുള്ളത് എങ്ങനെയെങ്കിലും ഒരു കല്ലിട്ട് അടിച്ചിട്ടുണ്ടാവും. സോ വി യൂഷ്വലി ബിക്കോസ് നമ്മുടെ പേഷ്യൻസ് ഇവിടുത്തെ നമ്മൾ പേഷ്യൻസിനോട് പറയും ബിക്കോസ് this one the motion will be inside the fecal matter. Some patients what they do കല്ലിൻ്റെ മുകളിൽ കൊണ്ടിട്ട് ഇങ്ങനെ ഉരച്ചൊക്കെ ചെയ്യും, അപ്പോഴേക്ക് ബാഗ് പോവും. Okay, so these bags are given on free. So we usually tell the patient no stone wash, no brushing. This is just hand wash. Okay, എന്താണ് മാക്സിൻ്റെ ഒക്കെ ചില ഡ്രസ്സസ് പറയുന്നില്ല ഹാൻഡ് വാഷിന്, അതുപോലെ they have to just remove this one. So about 30 to 45 minutes this will take for the return flow. So by the time what happens, the patient can just fold this, can go for a walk, okay, sit and read the newspaper. If you're having a long broom, they can broom it. By the 45 minutes, what happens? The colon is free. Okay, then they can just remove it. Okay. They can just remove it, go to the toilet, washroom, open this, okay, pour water to flush it, then make some soap and water, just rinse it in that, rinse in water, and then hang it somewhere on a rope and not in the sun because this is a rubber goods. Okay, it should be put in a shade. Okay, again the patient can wear a normal bag and the patient can go for the work. Why? Again, next day when the patient carries this procedure only, motion will come out. So by the time it is 21 days, it becomes a pattern for the patient. So until and unless the patient does the procedure, fecal matter won't come out. So some of our patients, they do it alternate days. Alternate days. So alternate days only they will have the bowel movement. And they are living a very normal life. Got it? So this you can tell your, thank you so much. This you can tell your patients also. Okay, so bags are there which is available now in the market. Coloplast is there, Convectex is there, Hollister is there, then one or two are there. But what they are giving is all these types of bags, which is very, very costly. they do tell each bag can be used for 5 days and 7 days. But many times the problem is with our abdomen. If our abdomen doesn't have a shape, when you put this, it becomes a big problem. Okay, now I will show you some pictures of that. Okay? So, if you put in your clinics or in the place where you are some pictures of colostomy, lymphedema, pressure ulcers, stages and all, it will be very good for the patients to read it. And I know own language, Malayalam. So now at least the patient will come to know what it is, especially with pressure ulcers and all, how to prevent it, what are the stages, what will happen. Okay. So this is the color of the stoma, pink color we say. Okay, so we tell the patient any color change, immediately you have to come to the hospital. You see, they have been using a cloth. This was a very, very bad bag. Previously, I think maybe more than 20, 25 years, 30 years back, this was what available. It causes a lot of skin problem. This is another bag. This bag is still available. It is cheap, but the problem is again skin allergy. I'm not going to all these things. I just want to, yeah. I told you, colostomy. This is an end colostomy which is done on a sigmoid colon which will have only one opening. Okay. Now, this is a double barrel colostomy, otherwise we say transverse colostomy, which will be done on a transverse colon which will have two openings, one for the mucus and one for the fecal matter. And this is a loop colostomy which is usually done on the this one, ascending colon, where they will put that loop, that's a brace. After 7 days, they will remove it. It's usually a temporary colostomy, but many times this happens, this will become a permanent colostomy, especially in cancer patients. See, nowadays, very new techniques have come, okay, but how far it is successful, till today we don't know about it, much we don't know about it. So, anatomy and physiology, anatomy is very important to know, which is the ascending colon, transverse colon, descending colon and sigmoid colon. So, I will just show you something. Crisis phase where we have to talk to the patient and the family right from the time they come in. First, counseling is very important. Before doing a colostomy, we need to do a counseling. I remember a 16-year-old girl from Orissa who was undergone a colostomy in medical college. Okay. She was not knowing what was happened to her because of language problem. She was so depressed. So we need to know because these things are very important. So counseling is very important, where they are going to do, why they are doing a stoma, where will be that stoma, after stoma what they have to do. Such type of counseling is very important to the patient as well as the family. Yeah, now you see this one. There is edema. Edema happens if the proper bag is not used, there will be edema. So that's why we say we have to take the correct size of the bag, we have to use it. Pouch selection. If we could see the patients, if the patient is using a transparent one, we can see it. Okay. That is another thing. This is allergic to the adhesive what they are using. I'll go to the last. The skincare. Patient just have to clean with normal water only. And the patient can do it with a soft cloth. Sexual life is very normal. And now the diet. When we talk about the diet, patient has to eat varied type of food. They can try any type of food. Once it is not suiting their body, leave it. Don't ask the patient to, you don't eat this, you don't. Previously it was like that. Not to eat non-vegetarian, leave cabbage, cauliflower, ginger, onion, garlic. This all causes a lot of smell. Now we say no. Try any food which is not suiting, stop it. Okay? But one more thing is about the diet is eating the food at a scheduled time. The patient should have a good breakfast. At 2 o'clock also you can take a small one, no problem. By 1 they can take their lunch. Okay. After that by 4 o'clock something they can have a little bit of snack. But the dinner should be by 7:30 to 8 they should finish their dinner. Why you know? Once they finish the dinner, within that 4 hours, after that 4 hours, this will start emptying. Suppose the patient is eating very late, what will happen? Whole night patient has to be in the toilet. Okay. So if the patient is having what we say is dinner should be just like a small snack. നമ്മളുടെയൊക്കെ സ്നാക്സ് എന്ന് പറഞ്ഞിട്ടുണ്ടെങ്കിൽ 2 റോളും ഒരു 2 എന്താണ് പറയാൻ തന്ന സമൂസ അല്ലേ, സമൂസയൊക്കെയാണ് നമ്മളുടെ സ്നാക്സ്. But that should not be that. Snack means it should be just one. So they can have just a small sandwich or something like that in the night. So that before by 10 or 11 they go to their bed, everything is empty. They can have a wash. They can apply a new bag, go to sleep. So that should be scheduling the eating habits, and even taking fluids also should be scheduled. Clear? I want to show you some. This is about the irrigation. This is how they do the irrigation. So the patients who are using on that washroom, it's only for their purpose, it is okay, but multiple people are using, they cannot do it. So this is a dermatitis. Okay, so skin excoriation will be, we have to treat it and also protect it. This is a retracted stoma. There will be stoma means you can see it should be out. Once it gets retracted, what happens? There will be leaking of fecal matter. We have a lot of things that can be used. Nowadays rings are coming. You can apply the ring and then you can put the bag on that. Okay. This is for retracted stoma, even you can use convex type of bags also. Okay. This is a prolapse. It's a bigger prolapse. If the prolapse recedes by itself, it's okay. Usually patient says, when I bend, it comes out. But once I am lying down, it recedes inside. Then it's okay. But if it doesn't, then it becomes a problem. I'll show you some more. Now you see, this is a parastomal hernia. What happens is, you can see the bag over there. This bag, see, it is not properly sticking, right? So what happens, it will start leaking from the sides. This is stenosis. Again, for the stenosis also they have to see the surgeon, because they have to do a dilation. Now, this is a patient, you see, it is out. Nothing was done for that patient because it was difficult. So till death the patient has to be like this. But motion was coming. There was no obstruction. This is a small prolapse which will recede. This is a necrosis. So that's what I told you. You need to teach the patient the color of the stoma. This is a complication what the patients have. Again, this is a retraction. This is a storm. I will go to some other thing. This I'll close it. Okay, skin excoriation. So the patient had a very bad skin damage over there. So what we apply is Karaya powder. Karaya powder with egg white. We can mix it and we can apply. Nothing is available. Zinc oxide powder is very good. Zinc oxide powder, make a paste with cooking oil or something and then we can apply it. Okay. I was talking about a Kinnam Vivekina, that is this patient. You see, 82 years old, undergone a colostomy. The patient was not able to even, you can see where she is wearing a skirt. It's very difficult at times when patient comes to communicate. We have to just listen to the patient. This patient, in fact, he died. You can see bag was there, but he landed with a fistula and he died because of depression. Because he said, already ഇവിടെ ഒരെണ്ണം ചെയ്തിട്ട് ഇതിൻ്റെ അകത്ത് വരുന്നു പറഞ്ഞു, പക്ഷെ എവിടെ നിന്നാ വരുന്നപ്പോൾ? That is one thing. This was another, this one obstruction. This was a physically challenged child, leaky from all the sides. Again, the problem was the back problem. You see, first ileostomy was done this side. It got obstructed. They did the colostomy on that side. How they are going to manage? I know one of my students' mother is admitted in the medical college with a stroke. She has undergone a urostomy on one side and one side colostomy. 2 backs. Now she had a stroke. She is in Calicut Medical College. It's very difficult. When you sit and, that's called suffering. There are no answers when we sit and talk to the patient. But at least they should feel that I'm listening to you. You can talk to me. Apart from physical, that is what we say, psychological and social problems. This is another patient. I just want to talk about it. One second. So I'll be just talking this patient. A background edukkarudhu adu madi and just a talk mathram edutha madi. I'll just show this and I'll talk to you. Can you see this? This is the actual this one. Patient has undergone a laparotomy. A fistula has formed over there. Okay. Now I'll just tell you the background of this patient. This patient was from Coorg. Okay. So Miss Lovely was talking about innovations and all. And I told you about the art and science of nursing. That's very important. Very poor patient who had come from Coorg after undergoing a laparotomy, and the patient had a fistula. Okay. And the patient has come to Calicut Medical College, admitted there, and the doctor said, once it gets healed, we will resuture it. And actually, resuturing was not an option for that. Anyone knows. Even the patient's wife, husband was knowing about it. So the patient was sent to our palliative care. You won't believe, whole one gauze was wrapped on the patient's abdomen. Why? Patient takes, it comes out through the hole. And you have seen that skin, it got excoriation. Okay, and it was burning for her. Okay, what the husband said was, he said, I know she's not going to live for a long time. It's the end of her life. But at least I want her to be free from pain. And whatever she is eating, she sees that it is coming out. You won't believe that lady was hardly 26 to 30 kg, not more than that. She has lost her weight also. Okay, so she was brought in, we made her to lie down, and we removed all the gauze, curtain we removed, and we can see everything is slowly coming out, enzymes, everything is coming out. Now what can be done? So I am an educator and I am an admin also over there, because I was holding the charge of the our palliative OP. Okay. So most of the procedures is done in our palliative OP, then only we send the patient to the inpatient. So many of the patients who comes with language problem, I need to talk to them also. Okay, so I spoke to them. When I had taken the patient to the procedure room, staff was asking, Stella ji, what we will do for this patient now? So I said, something has to be done for this patient because that is her wish. Okay. So what we did was, we did put karaya powder and all, we applied. She was feeling better because it was cool also. We have applied it with, mixed with the silocaine jelly, we applied it. Okay. And then what we did was, you all know the underpad, blue color, like what we saw as incontinence pad, we say. So we took that incontinence pad. Okay. I made a hole in the center and I applied that incontinence pad on her abdomen, means where that I just applied, and I made some pieces of that incontinence pad and told her husband, keep it on top of that hole, every 2 hours you remove it. So at least not much leaking will be there. Okay. And we asked them to come the next day. Okay. You won't believe that whole day I went home, I was in the kitchen, I was thinking what to be done. Sometimes some patients I feel little bit this one. I was thinking something can be done for that patient. What could be done? What could be done? Thinking. Finally, something came into my mind. Next day, as soon as we went, what we did, I will show you. We took a photo afterwards. This is what we did for the patient. That is the incontinence pad, what you are seeing. We made a hole, we put it, and we put this bag. You can see in the second. You can see that bag, that rim you can see. Okay. And we locked it at the bottom and we send the patient back. Okay. The patient was there for some time. After about 3 hours, we saw that all the enzymes slowly moving into the bag. So we gave extra 2-3 bags. We discharged the patient, and I told the husband, what you have foreseen that your wife is not going for a long time, that is for true. But at least till her death, she won't have much fun. That's what I said. Whatever resources we are having, sometimes we need to use it. Everything we won't get it. Okay. Now the another patient was the second patient I will show you. After surgery, you see multiple, even the drain where they have put also holes were, everywhere motion was coming. And you know what we did for that patient? You see. We number one hole, incopad, half we took, made holes here and there, wherever this was coming, put it, we put a bag on top of that. So what we could do. So what I mean to say is, always don't think that we can do a lot for the patients with the resources which are available. Sometimes we have to sit and think. I have found patients spending lakhs of rupees and coming back to palliative care and saying, we have spent whatever we are having. Now everything is empty. 500 rupees patients used to pay for dressing. And once they came to palliative care, they asked, എത്ര പൈസയാ കൊടുക്കണ്ടേ ഇവിടെ? ഞങ്ങൾ പറഞ്ഞു പൈസയൊന്നും വേണ്ടാന്ന്. In fact, discharge ചെയ്ത സമയത്ത് they donated the money to the palliative care. And one of their family, they are the volunteers for the palliative care now. അവരെല്ലാവരും ചിരിക്കുന്നുണ്ട്. So the important thing is, what we have, we should innovate new things. See, market is open, affordable people can get anything from the market. But what about the poor people? It's very difficult for them to get. So what we are having, we have to see what we can do for them. Okay, so one more inspiring video I will show you, then we all can go. Before that, I will ask your principal, with her permission, we can take a group photo, because I feel so many won't be there tomorrow. And for your all, knowledge I should say, for your understanding, your principal is my friend since 2011, I know her. Okay, so last video we will all see. Please go through this. Just see this one, okay? This video. What I was talking. This is about mathematics. Okay, mathematics tomorrow I will show you, because I think it is. Now you will have a video about empathy. Just have a look at, because tomorrow we will be talking something about speaking from the heart. So you can have a look at that. Just don't talk, just have a look at it. So that is what we say, empathy with compassion. Just having empathy is not enough. You should put it in action, right? Okay, so wherever you are in this world, even if you go to America, UK, anywhere, okay, once disease comes, this is what we are going to see. Whenever you walk through your corridors, when you are in your wards, you just observe the patients, observe the family member. I've taken a lot of photos where some patients, patient's family come and nicely sleeping. If you put a caption, we can say, this is a place where I'm resting because you are there to take care of them, right? Okay. And if you're really if you put yourself into this, you'll feel so good. I have completed more than 42 years. And still people keep asking me, how do you like to work only in this type of... I was in military, then I worked for a long time in Libya, then I went to Oman, where no bystanders, only me and my patients. And finally I ended with palliative care for more than 20 years now. Wow. But still I feel so happy. When I sit with someone and I talk, I just reflect myself to them and see, if I am in that place, one day I will also feel the same thing. There is no difference. None of you who are sitting, you cannot say that I'm not going to have cancer or I'm not going to have stroke or something. No. Morning you hear what the father said? I hope you all must have heard him what he said. Our generation, we are fine now. Hardly maybe 10 or 15 years again we'll go. I don't believe in that also. I believe maybe 8 more years I will be there and I will vanish from this world. But somebody is there to take care of me. But what about you? That is the next question. Build up something. Have compassion for the patient. I don't say only patient, have compassion as a human being. Be a human being. Money will be there, everything you will get, name, fame, everything will be there. But love is one thing which you cannot buy. Money will just come and go. Even I have seen patients, lakhs of rupees they spend, and finally they also land up in this stage only. So, see what they see, feel what they feel, and hear them. That will make you also happy. You should have that satisfaction. At the end of the day, you should have a satisfaction to say, I feel happy that I have done my best. You should be so confident. If someone asks me, I can say very well that I have done to my best. I have taken care. So, all the best. We will just have a pick because I think some people won't be there, and then we'll leave for tomorrow. Okay? Thank you all so much.
Thank you, ma'am.
പോണ്ടെങ്കിൽ പ്രശ്നമൊന്നുമില്ല, ഞങ്ങളുടെ കൂടെ ഇരിക്കാം. This is your pen. Someone gave me their pen. Whose is this? Aro pen. Someone has given your pen, huh? I think someone gave me from here only.